Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. 30 full-scale mock tests. 30 full-scale mock tests are going to give you the practice of 6,000 MCQs before the NEETPG exam every Thursday and Sunday. If you are from Hyderabad, be my guest. We have a face-to-face live center at Padmarao Nagar in Hyderabad. Please do come. And every MCQ is followed by 10 high-yield facts. And that way, around 60,000 high-yield facts get revised. And you get 30 PDF booklets of the explanatory answers, which has hand-sketched infographics that make you visually remember 10 high-yield facts for every MCQ. And every MCQ had been handpicked, which has a high probability of repeating in the real NEETPG 2026. So don't miss the mock test. So let's make the great beginning, Doctor. Good to see 9 online classmates. Very good. And can you please punch? Is my voice loud and clear for all of you, Doctor? Can you please punch? Now, a 24-year-old woman presents with fever, joint pain, oral ulcers, photosensitivity. Classically, this is SLE, which has got the malar rash. And you need to be very sure. If it is heliotrope rash, Gottron's papules, dermatomyositis. If it is central erythema, no systemic features, rosacea. If it is a scaly, greasy rash, then it is seborrheic dermatitis is what you need to basically remember. So I leave these infographics for you to do a rapid revision of around 10 facts. A 19-year-old with painless cervical lymphadenopathy with the evening rise of the temperature and weight loss for about 3 months is Hodgkin's lymphoma, Reed-Steinberg cells, which are all eye cells, is what you need to basically remember. So we do excisional biopsy, we give ABVD chemotherapy, and an NERBOR classification you need to be very sure about. The most common is nodular sclerosis type. Everything you should remember. I leave all that in this infographic hand-sketched mind map picnomic PDF of the solutions which had been sent to you. A 16-year-old presents with tremors, dysarthria, behavioral changes, progressive difficulty in writing. There is a decreased serum ceruloplasmin. Kaiser-Fischler rings have been given in the actual question paper which has been given to you. It is Wilson's disease. Wilson is autosomal recessive. ATP7B gene is the one which is responsible. Hepatic copper, more than 250 micrograms per gram dry weight of the liver is the classical feature. Patients can be asymptomatic with only increased LFT, and they can go into cirrhosis. And what are the differentials? Hemochromatosis, Huntington's, and Friedreich's ataxia. Increased alpha-fetoprotein, Friedreich's ataxia. CAG repeat, trinucleotide repeat is Huntington's, and hemochromatosis is increased ferritin. Bronze diabetes is what you need to basically remember. Can the online students can punch? Is the voice loud and clear for all of you, Doctor? Can you please punch? Let me be doubly reassured. Is my voice loud and clear? Thank you. Thank you for the response. Good. Now, a 22-year-old male develops acute onset of the skin lesions, which you are seeing here. These are typical target lesions, which are the characteristic feature of erythema multiforme. Herpes simplex infection is the most common trigger. And interface dermatitis. Interface dermatitis is the classical histopathological hallmark frequently tested in the NEETPG exam. A 28-year-old chronic low back pain, HLA-B27 positivity, syndesmophytes are found, bamboo spine is there. What else is required? It is ankylosing spondylitis. 6-year-old has recurrent seizures, developmental delay. Tram track appearance is classical of Stooge-Weber's syndrome is what you need to remember, where you have developmental delay, presence of glaucoma, Portwine stain, leptomeningeal angiomatosis. They're all the classical features which you need to remember. A 64-year-old man with the acute onset of breathlessness, orthopnea, and pink frothy sputum. And there is bat wing pulmonary edema, which is very classical of LV failure, is what you need to basically remember. So cardiomegaly, pulmonary edema, bat wing pattern, you need to be doubly sure. And whenever there is any congestive heart failure, avoid NSAIDs. Avoid verapamil diltiazem like calcium channel blockers. They decrease the rate. Contractility, inotropic state of the heart is what you need to remember. 23-year-old, chronic diarrhea, abdominal pain, weight loss, recurrent perianal fistulas. There is an iron deficiency anemia, elevated inflammatory markers, on barium study. So the actual barium of string sign of Kentort has been given to you in the online mock test, which you solve. So this is presently string sign on barium study is classical feature. Skip lesions, Crohn's disease. Transmural inflammation, Crohn's. Non-caseating granulomas, Crohn's. Perianal fistulas, Crohn's. You should not forget 10 classical things. On every topic you try to remember, doctor, you become the topper automatically, right? Crohn's versus ulcerative colitis had been the favorite question from times immemorial. So, can you please punch whether there is a good visibility? Yeah. Now, 48-year-old man, corkscrew appearance, diffuse esophageal spasm, simultaneous uncoordinated contractions with normal lower esophageal sphincter relaxation, unlike in achalasia. Normal ileus relaxation. But what is the problem in corkscrew? Simultaneous uncoordinated contractions are the classical feature which you need to basically remember. 67-year-old with persistent back pain, fatigue, recurrent infections, elevated ESR, hypercalcemia, monoclonal protein spike, and there are soap bubble lesions in the skull, classical of multiple myeloma, where you have punched out lytic lesions in the bone is what you need to remember. A 62-year-old chronic smoker, blue bloater, pink puffer, they are the types of COPD phenotypes. So there will be hypercapnia, hypoxia, cor pulmonale, peripheral edema, that is chronic bronchitis, which is called blue bloater. There is a hypocapnia, hypoxia, weight loss, barrel chest. He's the pink puffer is what you have to basically remember. So once more, doctor, FAV1 by FVC less than 0.70. You should not forget the spirometric appearance of the patient who has got COPD is what we should remember. All right. I leave all the other things for you because it is difficult to discuss in the short time all the 200 questions into 10 high-yield facts. That's the reason I created visually appealing, colored, illustrated, hand-sketched, picnomic infographics and mind maps that help you to remember visually, very, very important. So cor pulmonale, polycythemia, respiratory failure, recurrent infections, they're all the issues with the COPD is what you need to remember. 24-year-old primigravida with excessive vomiting, vaginal bleeding, uterine size larger than expected for the gestational age. What is this called? Snowstorm appearance of the hydatiform mole is what you have to basically remember. So you need to do suction evacuation and serial beta HCG follow-up is very, very important. And avoid pregnancy next 6 to 12 months is the most important thing that you need to remember. So you have a complete mole where there is no fetus and embryo, partial mole, molar pregnancy. 68-year-old with a history of hypertension, atrial fibrillation with a sudden painless loss of vision. Cherry red spot at the fovea, classical of central retinal artery occlusion is what you have to basically remember. So you need to know all these very important issues. The retinal tissues can tolerate the ischemia for only 2 hours, 1.5 to 2 hours. There's a reason it needs to be treated as an emergency is what you have to basically remember. So pale retina, cherry red spot at the fovea, classical of central retinal artery occlusion is what you have to remember. Any sudden painless monocular vision loss in the elderly who has the vascular risk factors is the classical feature that you see in case of Cravo is what we have to understand. Very good, doctor. So 58-year-old with progressive constipation, weight loss, altered bowel habits, occult blood in the stool, apple core lesion on barium enema. What is your answer? It is colon carcinoma is what you have to basically remember. So colon carcinoma histologically most commonly is adenocarcinoma. So obstruction, bleeding, perforation, metastasis to the liver, classical features. So we do either right or left hemicolectomy. Stage 3, we give adjuvant chemotherapy, and follow-up we do with colonoscopy and CEA levels is what you have to remember. 35-year-old presents with progressive dysphagia, bird beak appearance. One of the oldest questions, achalasia cardia is what we need to understand. So there is no lower esophageal sphincter relaxation, which is the key manometric finding in case of achalasia cardia. A 52-year-old postmenopausal woman with a painless lump in the upper outer quadrant of the breast with a recent nipple retraction. So the ground glass appearance on mammogram, classical of carcinoma breast is what you need to remember. So any speculated mass, microcalcification, ground glass opacity, think of carcinoma of the breast is what you have to remember. All right, doc. So we do sentinel lymph node biopsy. It avoids axillary dissection. We give tamoxifen, trastuzumab if HER2 positive, and breast conservation surgery. Whenever you do, you need to do radiotherapy after that. So these are all the points that you need to remember. Every NEETPG exam, invariably they will ask a question on the carcinoma of the breast. 45-year-old Presents with colicky, abdominal pain, repeated vomiting and abdominal distension and string of pearls. Appearance on the abdominal X-ray is classical of small bowel obstruction is what you need to understand. Now, 38-year-old progressive hip pain by walking, reduced range of motion, prolonged corticosteroid therapy, and on X-ray, there is a crescent sign, which is very classical of a vascular necrosis of the femoral head is what you have to basically remember. So core decompression is considered to be the treatment of a vascular necrosis. In an advanced stage, you need to do total hip replacement. These are the points. A 70-year bedridden patient presents with progressive abdominal distension and X-ray showing coffee bean sign on X-ray is classical of sigmoid volvulus. So, if it is a cecal volvulus, it is called kidney bean sign. So, how do you treat? Initially, rectal tube, IV fluid, electrolyte correction. Definitive treatment, you do sigmoidectomy with primary anastomosis is considered to be the treatment. A 5-year-old child presents with a high-grade fever, sore throat, drooling of saliva, muffled voice, respiratory distress, and there is a thumb sign on the neck X-ray. Enlarged epiglottis is present, which is the classical feature of epiglottitis, acute epiglottitis, which is the favorite MCQ. H. influenza type B is the most common organism, and the airway is the priority. So you have one group, which is tracheobronchitis group versus the epiglottitis. Epiglottitis is sudden onset, high fever, toxic, drooling, no barking cough, and the thumb sign. Gradual onset, low-grade fever, mild toxic, no drooling, barking cough, steeple sign on X-ray. Classical of laryngotracheobronchitis is what you need to remember. A 2-day-old neonate presents with persistent bilious vomiting. Double bubble sign is typical of duodenal atresia. A newborn develops weakness of the upper limb after a difficult vaginal delivery. Morose reflex is absent. Grasp reflex is preserved. It is Duchene's paralysis is what you need to remember. Grasp reflex is preserved. Clumkey is lower brachial plexus. C8T1. So there you have the claw hand. So I leave the literature for you, doctor. So please WhatsApp. You have the helpline number available, right? In order to get the PDF. Okay. Now, 24-year-old man sustains an injury after grabbing the branch while falling is classical of Klumpke's paralysis. He also has developed Horner syndrome, ptosis, meiosis, anhidrosis. They're all the classical features. So all the root values you should be good, doctor. C5, shoulder abduction. C6, elbow flexion. C7, elbow extension. C8, finger flexion, hand intrinsics. T1 are purely intrinsic muscles of the hand is what you have to basically remember. A 52-year-old chronic alcohol presents with abdominal distension with medulla head appearance is classical feature in portosystemic anastomosis. Portosystemic anastomosis. A charred body is brought for medico-legal autopsy after a house fire. On opening the skull cavity, there is a collection resembling the extradural hemorrhage is noted. That is called heat hematoma, which is the post-mortem artifact in intense heat that closely resembles the extradural hematoma is what you have to remember. A 48-year-old cartilage producing malignant cells with the chondrocytes in the lacunae is the classical feature of the chondrosarcoma. So the most common location is pelvis. There is a pain, swelling, restricted movement. And there is a typical calcification along the rings and arcs. Now, a 36-year-old woman presents with Samama bodies, which are eccentric calcifications, are the features of the papillary carcinoma of the thyroid is what you need to remember. So, thyroid nodule, cervical lymphadenopathy, hoarseness. This is the classical triad of papillary carcinoma. So, the ground glass nuclei with the nuclear grooves, intranuclear inclusions, they're all the classical features of papillary carcinoma. And it is the BRAF gene is the most common genetic mutation in papillary carcinoma of the thyroid. Cervical lymph node metastases are the classical feature. Total thyroidectomy with radioiodine, I-131, is considered to be the management of choice. A 22-year-old presents with pruritic skin eruptions, initially noticed a single lesion, which is typically called Herald patch, Christmas tree pattern, classical of pityriasis roseae, which is the reactivation of human herpes virus 6 and 7. A single large erythematous patch with colored scale is classical feature, which you should not forget. It is generally self-limiting in nature. Now, a 16-year-old presents with progressively increasing pain and swelling around the knee for the past 3 months. The sunburst appearance, Codman's triangle, osteogenic sarcoma is the classical feature. 12-year-old boy with fever, localized pain, swelling on the diaphysis of the femur for the past 2 months, onion skin periosteal reaction. You need to only think about Ewing's sarcoma is what I want to just go to all of you. So that is how Dr. Yeah. So the mock test 21 is being converted into this, doctor, mock test 2. Okay. I already arranged the question paper and also the explanatory booklet. We'll be uploading this mock test into the online system, right? And make it available for you. From next Sunday onwards, the offline question paper and the solution booklet and what you answer it on the website will both be the same from next Sunday onwards. We call that as mock test 3 instead of mock test 22. All right. So I hope that makes you get the point. Now, secondary spermatocytes undergoing meiosis to form spermatids. What will they produce? They produce spermatids, spermatogonia to primary spermatocytes to secondary spermatocytes. In this spermatogonia, primary spermatocyte stays struck, it is 2N. After that, it becomes 1N. Secondary spermatocyte produce the spermatids. So that's what you need to basically remember, right? So typically, what is the duration of one cycle of this entire spermatogenesis? It is 64 to 74 days. And Sertoli cells, they support, nourish, and form a blood testis barrier is what we have to basically remember. So spermatogonium is 2n, primary spermatocyte is 2n, which undergo meiosis 1 to form secondary spermatocyte, which is meiosis 2, that form the spermatids. They form the spermatozoa, is what you have to remember. Stratified cuboidal epithelium lines the duct of sweat and exocrine glands, actually. So the question asked was, which structure is characteristically lined by stratified cuboidal epithelium duct? Ducts of the sweat glands. So one question on histology invariably comes in every exam. Sudden onset of contralateral hemiplegia, hemisensory loss due to infarction involving the posterior limb of internal capsule. Posterior limb of the internal capsule is supplied by the anterior choroidal artery. Anterior choroidal artery supplies posterior limb of internal capsule, optic tract, choroid plexus, and hippocampus is what you have to remember. So the posterior limb of the internal capsule lead to contralateral hemiplegia plus sensory loss. So there is an anterior limb, there is a posterior limb, right? So this is what you have to basically remember. Anterior limb is supplied by middle cerebral artery. Genu is supplied by recurrent artery of Hubner, which is the branch of the anterior cerebral artery, and posterior cerebral artery is supplied by, posterior limb is supplied by anterior cerebral artery. The anterior choroidal artery is what we have to basically remember. Right, doctor? Now, so genu is supplied by the recurrent artery of the Hubner, which is the branch of the anterior cerebral artery. Anterior limb of the internal capsule is supplied by the middle cerebral artery, and posterior limb is supplied by anterior choroidal artery. Anterior choroidal artery also supplies the optic tract, choroid plexus, hippocampus. That's the reason whenever there is any infarct that lead to contralateral hemiplegia with hemisensory loss is what we have to remember. A surgeon is performing carotid artery, identifies a narrow loop, ansa cervicalis. So which muscle in the infrahyoid muscles is not supplied by ansa cervicalis? It is the thyrohyoid. Other than that, all the remaining muscles infrahyoid are supplied by the ansa cervicalis is what we have to basically remember. Sternothyroid, sternohyoid, superior belly of omohyoid. They're all supplied by ansa cervicalis, which has a root C1, C2, C3. Whereas thyrohyoid is supplied by C1 root via hypoglossal nerve is what we have to remember. Any motor neuron primarily innervate the intrafusal muscle fibers to regulate the muscle tone. So it is the A gamma fiber, A gamma type of motor fiber. It innervates the intrafusal fibers. And the afferent 1A fiber takes the sensory feedback about the muscle stretch. So this is one of the favorite questions of the examiner when you look at all the PYQs, doctor. Every time they ask one question on Golgi tendon organ and the stretch reflex. So I leave the literature for you. Please try to review this topic thoroughly. Favorite question of the examiner. 1A is primary, 2 is secondary fiber. Now, a defect in Sarca pump in skeletal muscle impairs what? The normal purpose of Sarca is it pumps the calcium back into the sarcoplasmic reticulum. It lowers the cytosolic calcium, and that lead to the muscle relaxation is what you need to basically remember. So sarcoplasmic sarcoplasmic, endoplasmic reticulum calcium ATPase is the name given for the SARCA. So it leads to calcium reuptake, and that leads to the muscle relaxation is what we need to understand. So muscle contraction is the favorite MCQ of the examiner. So who releases the calcium, doctor? It is the rhinodine receptor that releases the calcium from the sarcoplasmic reticulum. The opposite is done by SARCA, where it picks back the released calcium so that muscle relaxes. Rhinodine receptor, calcium releases, muscle contraction. SARCA, calcium reuptake, muscle relaxation. Clear? Clear. Now, whenever light falls, there is an activation of the rhodopsin, all transretinal. Transducin activation, which is the G protein. Phosphodiesterase activation, cyclic GMP degradation, that lead to closure of sodium channels, and that lead to decreased sodium influx, and that lead to hyperpolarization and membrane potential become more negative. That is how the effect of the light, which typically will make the 11-cis retinol typically become all trans retinol, and that lead to the activation of the rhodopsin is what you need to basically remember. So rhodopsin, transducin, phosphodiesterase, cyclic GMP degradation, sodium channel closure, low cyclic GMP, hyperpolarization. These are all the effects which you need to basically remember. So it is the key ion involved is sodium. When the light falls, how is it perceived? It is the sodium influx decrease is what you have to basically understand. Now, doctor, EEG, there is no NEETPG without EEG. 14-year-old boy has nocturnal increase in luteinizing hormone production with the onset of the puberty. Which hormonal surge most commonly occurs during this stage of sleep? NREM sleep. So you should remember theta waves to delta waves during NREM. During the REM sleep, EEG will show beta like wakefulness. There is a loss of muscle tone except diaphragm eye muscles in REM sleep. And the dreams unrelated to daily activities happen in REM sleep. Dreams related to daily activities occur in NREM. There's a decreased heart rate, decreased BP, decreased body temperature when we go into REM sleep. Whereas growth hormone, prolactin, luteinizing hormone, all their surge happens during NREM sleep is what you need to remember. So from the pons to lateral geniculate to occipital cortex, they are called the pontogeniculo-occipital spikes that you typically see NREM. In that, N3 is called the slow wave sleep, whereas REM, it resembles wakefulness with beta waves is what you have to basically remember. A patient with uncontrolled type 2 diabetes has an impaired insulin-mediated glucose uptake in the skeletal muscle and adipose tissue. So you should remember, it is the GLUT4 receptors which are insulin-dependent receptors. GLUT1, all tissues, basal. GLUT2, liver, beta cells and intestine. GLUT3, brain and neurons. GLUT4, the muscle and adipose tissue, and GLUT4 is insulin dependent. GLUT5 is F for 5, F for fructose transport. That is what you have to ultimately remember for the NEETPG. A laboratory worker exposed to the cyanide develops lactic acidosis. So cyanide inhibits cytochrome C oxidase and always electron transport chain. Favorite topic for the examiner. A 6-month-old infant with severe fasting hypoglycemia, hepatomegaly, lactic acidosis. What else you need? Von Geierke disease, fasting hypoglycemia, hepatomegaly, lactic acidosis. Von Geierke is glucose 6-phosphatase deficiency. It is located in endoplasmic reticulum, right? So type 2 is POMP, lysosomal acid alpha glucosidase deficiency. Type 3 is Cori debranching enzyme deficiency. Type 5 is McArdle muscle phosphorylase deficiency. Without a question on glycogen storage disorders, exam nahi hoga, nahi hoga, nahi hoga. Right? So you have to be sure, doctor. Once more, if you look at the NEETPG question paper, invariably in microbiology, one question comes from Streptococcus, Staphylococcus, gram-positive cocci. How do you differentiate? Which is bacitracin, novobiocin, optachin, bile solubility, esquilin. You need to be very sure, right? So alpha hemolytic catalase negative cocci that are optachin resistant and bile insoluble. What do you think, doctor? It is viridans streptococci. Viridans streptococci is what you need to basically remember. They're catalase negative, enterococcus. Catalase negative, bilesculin positive, grow in 6.5% NaCl is enterococcus. So I leave the literature for you, doctor. Viridans, Streptococcus pneumoniae, enterococcus. Viridans, Streptococcus, alpha hemolytic, enterococcus, gamma hemolytic. They're all catalase negative. But Streptococcus pneumoniae is optachin positive, sensitive. Bile solubility. Typically, solubility is there for pneumonia only. Bilesculin. It is positive for Enterococcus fecalis. So that is how you need to basically remember. A child develops bloody diarrhea followed by the hemolytic uremic syndrome after infection with enterohemorrhagic E. coli. So how does E. coli's O157H7 toxin, which is called Shiga toxin, it inhibits the protein synthesis by binding to the 60S ribosomal subunit is what you need to remember. What is hemolytic uremic syndrome, doctor? Hemolytic anemia, acute renal failure, thrombocytopenia. The combination is hemolytic uremic syndrome is what you have to remember. 45-year-old farmer with chronic pulmonary infection, partially acid fast, aerobic organism. What are we talking about? We are talking about the nocardia. So, nocardia, partially acid fast, anaerobic is, and it is aerobic. Actinomyces, anaerobic. Stain is non-acid fast. Location is normal flora, is actinomyces. Chronic pulmonary infection is nocardiosis. Chronic suppurative infection is actinomyces. Penicillin G is actinomyces. Sulfonamides, nocardia. Gram-positive branching filaments are common to both the nocardia and also the actinomyces is what you need to remember. Be very sure, doctor. One question aayega, actinomyces, nocardia. You will remember Murli Bharadwaj. So now, doctor. Good. We are maintaining a good run rate. So, a urine-based lipoarabinomenon is used for the rapid diagnosis of TB, especially in which subset of population, doctor? HIV positive with advanced immunosuppression. You use the lipoarabinomenon LAM assay is what you need to basically remember. A obese patient receives a highly lipophilic drug that is extensively distributed in the adipose tissue. So which pharmacokinetic change is most likely to occur? Obesity increases the apparent volume of distribution because of the fat solubility. Albumin binding decreases the VD. Lipophilic drugs have high VD. Hydrophilic drugs have low VD. Obese people with lot of fat, a lipophilic drug get extensively distributed is what you need to basically remember. I leave the literature for you, doctor. The loading dose is especially required for those drugs which have a very high volume of distribution. So diazepam, digoxin, propofol, they are all examples of high volume of distribution. Heparin, gentamicin, lithium, they are all the examples of low volume of distribution is what we need to remember. A patient on chronic antiplatelet therapy, right? So develops a drug toxicity after a small increase in the dose due to saturation of hepatic metabolism. So which drug lead to zero-order kinetics, doctor? You need to remember. Alcohol, phenytoin, warfarin, propylene, methanol. You have to buttify this, right? Ratta maro, magar yaad rakho. First order kinetics का ऐसा रहता है graph. Zero order kinetics का ऐसा होता है graph. You need to be very sure. Examiner will only graph दिखाएगा और बोलेगा मालूम है नहीं तो मैं fail करूंगा. So be very, very sure, doctor. Now, 65-year-old man, long-term therapy with ventricular arrhythmias develops progressive dyspnea and dry cough. There is an interstitial lung disease. Typically, amiodarone can lead to development of pulmonary fibrosis. Pulmonary fibrosis, which you need to remember. So everything on amiodarone. Corneal deposits, pulmonary fibrosis. Lipofuscin deposition in the sun-exposed area, both hypo and hyperthyroidism, photosensitivity, myopathy, hepatotoxicity, long half-life of 30 to 50 days. They're all features which you need to remember about the amiodarone. Now, doctor, the last question for today's evening, I anyway left the PDF to you. The whole job of the teacher is to stimulate you, to push you, to ignite you, and to keep your visual memory, hand-sketched, visual, picnomic, infographic mind maps, which are color illustrated, like a comic book for you to become the topper. 30 PDFs मिल जाएगा आपको 30 mock test के लिए, right, doctor? So 22-year-old severe allergic asthma. Which monoclonal antibody is used in asthma? Omalizumab, which is anti-immunoglobulin E, is what you have to basically remember. Right, doctor? Omalizumab, IgE, infliximab, TNF-alpha, rituximab, CD20. Trastuzumab is HER2. These are all the favorite questions of the examiner. So, thanks for a patient listening. We have successfully done 50 questions in 45 minutes. I'm sure we can finish all 200 questions in about a couple of hours of discussion, right? But what is important, next time onwards, I'll give the paper one day before only. Solve the paper, be ready for discussion, and I will give you 200 pages ka booklet containing all these picnomics for you to do the revision. Just this 30 question papers attend karo, 200 out of 200 questions agar isse nahi aaye to मैं Dr. Murli Bharadwaj nahi hu. ठीक है? So, good night and God bless you.